To the September Western Reserve Safety Council meeting. We're certainly excited to have everybody here. We have got a really unique program today. You could probably call it like a buffet. So if you like buffets, I'm wondering if those are kind of faded out with COVID stuff, but if you enjoy buffets, we have got some great folks from the private sector, some great folks from the public safety sector. To share some learnings and some resources. I think it's just going to be a great opportunity. We're also going to hear from them, but one of the things we're going to do new this time that I don't think we've done before is have several breakout rooms at the end where you'll be able to go and talk to these individuals, ask questions, make some connections, and just really again make those resources locally, which is going to be really great. So it's something that we have not done. We're looking forward to it. It should be great. So we've got that buffet coming up. Evolution of the workplace, local resources from local experts. So that's the title of it, and we will get started here in about a minute as people are coming on. You can also see like all the slides that we'll be taking a look at today will be available at the solonchamber.com/slides. So that website is a very good resource. So don't try to write everything down here. Maybe jot a couple notes, but if you want to go back and review slides, a great opportunity. Tom and Kaylin do a great job of making that Solon Chamber website very user friendly. You can join our LinkedIn group as well. So please take advantage of all that the Solon Chamber does have to offer. All right, once again, welcome to the September Western Reserve Safety Council meeting. Again, we're going to have more of buffet style with local experts sharing resources, both from the public safety sector and then also private safety sector, whether it's training or health solutions or PPE and safety gear. It's going to be a great opportunity for us to hear from them, but then also to be able to join rooms later on in the meeting and be able to interact with those folks. So really looking forward to this new format. We certainly hope it'll be a benefit to you, and certainly share any type of feedback you have with us now or after the meeting. But I want to turn it over to our BWC representative, Dan. Dan is going to, I believe, share some slides. Actually, go to the next one. Okay, right before Dan, flip back to that. Okay. So again, just want to call out next month, there is not going to be a local Western Reserve Safety Committee meeting, but council meeting. It's going to be a statewide one. So really looking forward to that. You can see some of the speakers there. There's no cost, obviously no RSVP to attend virtually, but would you consider perhaps joining with us? And you'll get some information later on about joining us, a box lunch where we can kind of meet a little bit more in person and watch this meeting together. So that'll take place at the Town Place Suites. We're certainly looking forward to that. All right, now I'm going to turn it over to Dan. He's going to share some BWC updates. Take it away, Dan.
Hey, everybody. Good to see you. Hope everything is going well and everybody's staying safe. Just some usual updates that we talk about, some talking points here. The COVID-19 Indoor Air Quality Assistance Program, they've actually extended the date there. So if that's something that you would like to look into in regards to like a small grant, you can certainly look into that or contact myself and I can provide some information for you on that. Next slide, please. These are the other grants programs as well. I know I've been talking about these for the past few months, but they're still out there. And for those that are eligible, you can certainly take advantage of those, such as the Trench Safety Grant, the Firefighter Exposure Elements Grant, the Employers Working with Persons with Developmental Disabilities Grant, and the School Safety and Security Grant. Private employer dates here. We have the experience snapshot for for year 2022, the group experience rating deadline, and the policy activity rebate enrollment deadline as well. So you may need to put these in your calendar if that's something that you're going to be having to accomplish there. These are some public employer dates as well. We have due on the 30th. There's a number of them there. The one claim program. And then we also have the 2022 estimated annual program premium notices that are being mailed. And you can see them there on your screen. So if that's something that is, again, that you need to complete, go ahead and put that down. And then we're already looking into November, which is crazy, but November 30th, the TWB bonus application is due. ISSP, for those who are looking for that 3% rebate, would like to get the rebate, your applications are due, and the policy activity completion is due also in November. We have some BWC, the employer webinars, like I always talk about. Those are coming up on September 14th and the 30th. Again, all the dates that I emphasize or I talk about are in those employer webinars. So I encourage you, they're only a half hour, so put those into your calendar if you have an opportunity, and you can certainly review those as well. Next slide, please. Thank you. BWC safety webinars. This is going to be an ongoing thing. We kind of started some of these. We did start these during COVID, but these are going to be ongoing. Whenever we go back to in-person training, we're still going to be doing these webinars as well. So we have this one coming up. So if that's something you'd be interested in, certainly take a look at it. Virtual trainings. Those are also going to be another thing that's going to be ongoing with the BWC here, like I mentioned in the previous slide. So if there's a topic here that you would like to participate in, you certainly can. And, you know, invite your other employees as well. They can certainly participate in this virtual training too. Updated resources. We updated our safety talks page. There's 57 updated safety talks. They're about 2 pages. So if you do toolbox talks with your employees or some sort of huddle in the morning, you can certainly utilize those. We also have template written programs so that you can certainly, if you want to build on your program or you're building a new program, you can certainly use our template written programs. And, you know, let me know if you need assistance with that, because I can certainly help you with that as well. Our consultative services are still suspended, but again, I'm here by phone, email, and you can certainly contact me if needed. And we also have our COVID resources. Those are still on our website and ODHs as well. Other than that, I have nothing else, and I thank you for your time, and I'll turn it back over to Matt.
Cool. Thanks, Dan. Appreciate all the resources that the BWC provides. If you've not seen our video, I know that goofy guy looking there, but several of our steering committee members kind of made a video of the Western Reserve Safety Council. Who are we? What are we all about? So be sure to check that out. That's available at the Solon Chamber website as well. But just again, trying to share this out with as many people within your company, but also consider maybe some sponsorship opportunities. If you want to get your company out more out front, kind of sharing who you are and what you do, we've got some sponsorship opportunities. We'd certainly love to have you join us in our mission to help keep everybody safe and healthy. So certainly encourage you there. Want to just share before we get into the main reason why we're here, which is the local experts. I do want to share the motto of the month. It's been a couple months since we have done that, but the motto of the month for September is turn your attention to injury and incident prevention. Turn your attention to injury and incident prevention. And what I would encourage you today is, as you listen to these local safety experts, as you listen to some of the companies that share what they provide, think about, is there 1 or 2 things that you could put into practice that could prevent an injury, could prevent an incident? And I think you're going to get a wealth of information today, but try to pick 1 or 2 that you could put into practice, perhaps at your workplace there, but also consider how you can make yourself safer as you're driving the roads, as you're at home with your family as well. It's going to be a great opportunity to hear from some local experts. So we're certainly looking forward. Again, we do want to thank all of our sponsors. You can see them there: Zercoa, Swagelock, Greater Cleveland Habitat for Humanity. We've got the Cleveland Clinic, Nestle, North Coast Shredding, Integrity Staffing. Certainly appreciate all that you guys do to help us be able to share out this great content, and great partners in the community can help you and your business depending on what your needs are. So please take advantage of that, and make use of again, the local resources that we have that are part of our council. So here's what we're going to do. We've got really two sections of our program. We're going to hear from 6 folks, and you can see Assistant Chief Stephen Shebeck is going to be up first from the Solon Fire Department. We also have Sergeant Courtenay Perkins from the Solon Police Department, Nick from Chagrin Valley Dispatch. Those are our public safety folks who are going to be sharing some thoughts about what we can do to be safe, but a little bit more about what they do. We got Tarry from US Safety Gear. We'll have Tony from Ving, and then Bill from Be Well Solutions, kind of sharing what they're about. And as you're listening to their about 5-minute presentation, so just an encouragement to the folks that are presenting, target about 5 minutes per presentation. I'll blow a whistle if I have to, but try to land the ship about 5 minutes in. But be listening, because you're going to have an opportunity to go to 4 different rooms. One for the public safety folks are going to go in one room, and then we're going to have again Ving, we're going to have Be Well, and then the US Safety Gear in 3 other separate rooms, and you'll be able to switch around. So as you're listening to these presentations, be thinking about a question you want to ask, maybe see what resources they can provide, a follow-up to what they brought about, but really looking forward to this time. So without any further ado, I'm going to turn it over to Assistant Chief Stephen Shebeck. Thank you for all you do and the fire department does. And why don't you take it away and share a few things about what you guys do at the Solon Fire Department, some things we should be thinking about that can help us work safe and live safe.
Very good. Well, thanks for inviting me in to your meeting and giving us a chance to talk a little bit here. So I've been with the organization over 25 years now, and I'm second in command, and I'm responsible more for the logistics side of the operations here. So we have a chief, an assistant chief, and then we have 3, we call them battalion chiefs, but they run each of our shifts because we're a 3-shift operation. The guys work 24 on, 48 off. So we have basically 5 chief officers in the department. We spread the wealth out, but I get stuck doing all the support stuff. So kind of fulfilling at times, kind of frustrating at times. So anyhow, so COVID's been a very interesting experience for us. And one of the bullet points is, how has this safety evolved within our company organization through COVID? Well, the biggest thing we've had to increase is our sanitation and disinfection. Now, we routinely did that prior to COVID, but with the tenacity of the virus, we're requiring to do a lot more disinfecting and protection for our people within the organization. So that's kind of been a culture change. Guys are wearing PPE a lot more often. Our dispatch center, which Nick will talk about here, I'm sure, does a screening process for our callers. So then the dispatcher can let us know that there is a potential this person has been exposed to COVID. So we'll do a higher level of personal protective equipment application for our crews, because we really can't afford, just like the hospital systems really can't afford to have folks out with the virus. So it really impacts our operation. The other side that's really impacted us is our ability to do the prevention side of our business, which keeps us from having to deal with disasters. So we've had to scale back fire safety inspections, where our inspectors aren't getting out into your facilities to review all the things that are supposed to be inspected on a yearly basis. So that's kind of impacted us a little bit, and it's mainly out of courtesy to you folks as well, so that we're not potentially bringing something into your operation, and respecting the integrity of your efforts to maintain your workforce and exposures. And the other thing that's really hampered us is being able to get out and do education. You know, you've seen us, some of your businesses doing fire extinguisher demos. We like to get our crews out and do company tours in the facilities within our jurisdiction, so they have situational awareness of the interior of the building. So that's been a big impact with COVID. And as things change, we try to open up a little bit, and then we're constantly adjusting. We basically have different levels of awareness within our organization. And as the COVID changes, we change that situational awareness. So the guys have to change operations just a little bit there. The other thing, one or two items on how our service product has evolved through COVID. It's been adaptation for sure. Trying to adapt and, like I said, protect the crews, but also we have to do a little bit more of a proactive approach when we're transporting to try and not overload facilities with patients. We almost, at the height of the pandemic, got to the point of doing field triaging, which was really going to be tricky. We've talked and dabbled in telemedicine. We do a telestroke program with Ahuja, where we actually do a stroke assessment using a secured video conferencing platform. And there were talks of actually evolving that into doing field assessments to see if a patient really needed to be brought into the ER or could be done at home. And that's kind of going into, I don't know if you've heard of the phrase community paramedicine. That's kind of an up and coming thing, but we kind of touched the fringe of it and didn't get too far into it, but that could be forthcoming if things continue to fluctuate, I guess you would say, in the world here. The other thing we've done is we've added a lot of UV disinfecting. So our air quality is now all UV disinfected, and we actually have a portable UV disinfecting unit that we use in our ambulances. So we do that on a regular basis along with other disinfecting. And of course, I'm sure all of you folks have done the same thing as touchless fixtures, touchless dispensers, trying to minimize touch points and areas that need to be disinfected. So that's kind of how it's evolved for us. And then lastly, probably the takeaways is our biggest challenge during this whole thing was keeping our workforce healthy. So trying to get our folks to practice the same principles outside of work that they were practicing within the organization while they were here. And we had some exposures because people kind of let their guard down. And interestingly enough, we did a great job internally because we never had any exposures that could be traced back to patient contact, but we had exposures in people with illnesses outside of the organization just because they let their guard down. So we're constantly trying to educate people that, you got to respect this, you got to be, conscious of your surroundings and stuff. And now we're seeing, we actually have a couple folks that got infected from their school age kids as the schools are starting to open back up. So it's constantly evolving, and we do regular meetings with the county health department and our medical directors on trends and possible preventions that we can do, and just awareness to, and it really has brought a real continuity of the medical team together, because we're talking medical directors from all three hospital systems, clinic and Metro, along with the county. So it's been really good on that side of it, sharing common practices and recommendations for all the organizations. So I hope I was within the 5 minutes there.
Yeah, Steve, you nailed it. That's great. Hey, thank you for all you and your team does. We're very blessed to have such a strong support, Solon Fire, EMS. You guys do a fantastic job. So thank you for all you do. And again, folks, be considering maybe what questions you want to ask Steve later on when we break out into the groups. Okay.
And even afterwards, you can always reach out to the fire department. We've got folks here during the day. We got some specialists on different shifts that we can always assist with you folks.
Yep, that's great. Thanks so much. All right, going to turn it over to Sergeant Courtenay Perkins, who's going to share a little bit about from a police perspective. Take it away.
Hi, thanks for having me. As far as from the police department side, sorry, I guess I'll introduce myself. I know it's on the screen there. Sergeant Courtenay Perkins with the Solon Police Department. I've been here 11 years. Wonderful department, great community that we serve here. So we want to thank everybody for that first and foremost. It is a partnership, and we truly do appreciate all sides of the equation, our businesses, our residents, our schools, our city in general. So thanks for having me. As far as the police department side, a few of the things that we've been doing. First, we've been taking extra care for PPE, the personal protective equipment. That's something that I'll be honest, in law enforcement, prior to COVID, it wasn't something that we always paid a whole lot of attention to. Officers would, search people. Officers would search cars, and sometimes they were lax and didn't put on their gloves and didn't do some of the things that they were supposed to do. But with COVID coming and affecting us the way that it has, officers have had an increased awareness to use that personal protective equipment, wearing gloves, wearing masks, even wearing goggles in situations where there could be transfer from mouth, into somebody's personal space, getting into their face. So guys have done a really good job of that. One of the other things that we've been doing as an organization is thoroughly cleaning our workspaces, primarily our police cruiser. Our cruiser is our office. We spend more time in a cruiser than we do anywhere else. And there's a lot of buttons and a lot of knobs, a lot of equipment within the vehicles that officers touch on a regular basis, gear shifts, our window control buttons, our siren buttons, radios, push button radios, and everything like that. So officers have been thoroughly cleaning those workspaces to make sure that from shift to shift, we're not transmitting or leaving a surface untouched. So as far as the items that have evolved through COVID, one of the things that we have done is we've tried to do reporting by phone to minimize exposure to the people who are calling us for assistance, but the officers as well. So if it's a report that's more informational, not necessarily criminal, where we don't need affidavits to be signed, we don't need other documentation that is going to go forward to court, we would take those reports by phone. The officer would get the statement and then confirm everything via phone, and then give the report number over the phone. And then if it's needed or we need to do any follow-up, or if it does evolve into something where we would need written documentation and signatures and affidavits, then we would follow that up on the back end. But taking that initial report by phone. One of the other things that we've done as an organization, and this has come across with the Ohio Department of Corrections as well, is try to minimize the number of people we have going into our correctional facility. So if it's something that maybe in the past we would arrest for, if the situation warrants, we would issue a summons instead. So on the legal end, it's the same as far as the person still has to be held accountable. They're going to go to court. They're going to have to deal with the criminal end the same. The only difference is that they would not have to go to our jail facility, get fingerprinted, and get booked as they normally would. So it hasn't done anything as far as public safety. It's not doing anything to affect the community in that way, but it's just a process. Instead of it starting with jail and paperwork going forward that way, it would start with a summons, which is a very similar legal document, and then the person would then have to respond to court and take care of their business there. And then from there, status quo. I mentioned status quo because, regardless, we've been out here doing what we have to do. So we've still been making traffic stops. We've still been enforcing law. We've still been, serving the public in general in any way that we can. We answer the call regardless of what it is. So although COVID has come and it's had us do some things different in general, everything that we've done before COVID, we're still doing. We might do it a little bit differently. Our public education looks different. We've been doing a lot of Zooms and things like that. But we have not changed what we do because it's just a necessity that we have to do it. So the final thing that we just want to say is, we're always here. So 24/7, 365, give us a call. We're going to respond accordingly and do what we can to take care of our residents and our businesses, our community. So thank you.
Yeah, thanks, Courtney. You guys, again, police department's been a fantastic partner. I know at Nestle we've had you guys come in several times, give us guidance and counsel on things. And anytime we've had a situation come up where we, had questions, you guys have been great and really helped us out quite a bit. That's great. Okay. I think we're going to turn it over to Nick from the Chagrin Valley Dispatch. It's the last of our public safety representatives. So Nick, why don't you take it away?
All right, thanks for having me, everybody. My name is Nick DiCicco. I'm the current director of Chagrin Valley Dispatch. I've got over 30 years of public safety experience, retired policeman out of Orange, and I'm still currently a firefighter paramedic over there just to keep busy. We'll just put it that way. But Chagrin Valley Dispatch is a regional dispatch center. We dispatch for police, fire, and EMS. We have 3 different facilities. 2 of the facilities are located in local outreach hospitals. Our main one is at the Bedford Hospital. Our other one is in Metro in Cleveland Heights. And our third one is in Brecksville. We employ approximately 100 full-time employees. We dispatch for 31 municipalities. We also dispatch for the Cuyahoga County Sheriff's Department and the Cleveland Metro Parks Police Department. So we have a total of 33 different entities, which equates to, I think we're up to 37 fire stations. And obviously we are a 24/7 operations. Our shift minimum is 23, so we have 23 dispatchers at all times that are working. Our obstacles are, we are a council of government. So while we are still a government agency, we are not a city, village, or township. And that just equates to we were not able to get any CARES funding whatsoever. So as our overtime costs skyrocketed, whether it was for mandatory isolation or just upstaffing due to the uptick in call volume, it all obviously came out of our general budget, and we blew through the overtime in a matter of 3 months. We obviously, because we are in a medical facility, we are still in lockdown. There are no visitors unless it's business related. That was one of probably the biggest, hardest hits for our employees, because with so many police departments, the first thing that happens on day shift and night shift is the canine officers come down to visit. And as silly as it sounds, you'd be amazed at how much you're bringing in a 4-legged partner comes in that just brightens up the room. That 5-10 minutes of playing with the dog, throwing his toy, giving him a cookie, it really went a long way with my staff. So that was probably one of the biggest downfalls. And I know it sounds silly, but the buzzwords now are the mental health and trying to keep everybody happy and take that deep breath and relax. The dogs went a long, long way. So with the COG funding, it was rough, because the employees, when other people from again city, villages, or townships were isolated, those municipalities that took part of the CARES funding, they got that extra 80 hours off. So when we had an exposure, whether there was their child, themselves, a spouse, they had to use their sick time. And that caused World War III with our facility, just trying to explain to them, listen, we didn't get that grant. We're not eligible for it. So they still got their paychecks, but they had to use their own sick time. No takeout. Obviously, because we're 24/7, there's no restaurants open up at 2 a.m, so we rely a lot on takeout. That we put a kibosh to that. We had to make makeshift 5-gallon buckets that you buy at Home Depot, and we happened to have one of our supervisors' husband's a chiropractor, so we had to think outside the box to get big commercial wipes, and we just threw them in a 5-gallon pail, and they're mandated to wipe down their councils at the beginning of the shift and then every 4 hours after that. If they're vaccinated, they didn't have to wear a mask while at their position, but the minute they got up, they had a mask up. And you can imagine trying to wear a mask while you're answering 911 calls, 10 digits, and trying to talk on the radio. It was tough. The one thing that we initially did that we got all of our mayors to buy in is, because we're truly a consortium, and we love all of our different partners, is we went out and bought one of those moonbeams. I think we were the second agency in the state as soon as this kicked off. Very expensive piece of equipment, but not only did we do all of our positions every other day, we opened it up and we did drive-through services for all of the ambulances and the members that we serve. So we did well over 1,500 ambulances every single Saturday. There was no cost for it because we've already paid for it. It worked really, really well. It made for really long Saturdays. But again, it's all about that partnership, and Courtenay hit on it. Without the businesses, the residents, our partners in police and fire, it just doesn't work. We truly are one big happy family. And then, with the screening in the hospitals, and again, it's still going on today because they haven't lifted those restrictions with the hospitals, is, the employees come in, whether it's on day shift, afternoon, or midnight shift, they got to get screened by the nurse in the emergency room. They come on down into work, and then, again, we screen them. So, and then really the only other big issues that we had is, obviously my staff is majority female. So when the lockdowns happened and remote learning, we had to come up with some creative plans and scheduling for childcare, because the moms were the primary caregiver while, mainly dads are at work. Those that were on day shift, we worked around it because the kids are home now, unsupervised. We obviously had a different set of rules for isolation because we're essential employees versus somebody in the regular work field. We struggled with PPE supplies initially until our county EMA, got their stock in. It was no fault of theirs, no fault of ours. It was just, demand was high, very, very high. But our biggest thing that we're experiencing now with this new Delta variant, it really has nothing to do with the Delta variant, is everybody's tired. It's been over a year. Our call volume for our member municipalities has gone through the roof. The amount of pursuits is tenfold. Shots fired are tenfold. Our bigger, higher crime communities, homicides are up. So it's taken a toll on our staff, just with the pure call volume. But it's something that we do every day. We love what we do. And same thing like everybody else says, we're here. Anybody that wants us to come out and talk about, wireless 911 calling and how it really works, and where you get routed to, we love to come out to the community. So, and with that, I really thank you for giving me the opportunity to share what we do.
No, thank you, Nick. I mean, your team is the first voice that somebody hears on maybe one of the worst days of their life, and you help get them the support that they need. So we thank you. And just want to stop after the public safety folks and just round of applause to you, to the police department, to the fire department. You guys work in conjunction, work together to keep us safe. And we just, from the Western Reserve Safety Council and all the folks that are on, we just want to say thank you to the three departments, the three entities that you guys represent. So thank you very much. All righty. I think we're going to move on into U.S. Safety Gear. We're going to turn it over to Tarry Alberini.
Hey, Matt, how you doing? Thank you, Solon Safety Council, for having me on. I truly appreciate it. Can you hear me okay?
You're good.
Okay, thank you. I told Matt I'm doing double duty today. I feel like a newscaster from Channel 8. I'm doing a live remote down here at a safety event for PTC Alliance in Alliance, Ohio. So there's a big tent down there, and our salespeople are down there. And I'm actually doing this out of my car. So if you hear some noise and things in the background, that's the sound of work, and that's the sound of people making some money, I guess, and hopefully they're staying safe too as well. But I wanted to share something with you. I listened to the guys in the safety forces talk, the first three gentlemen, and I don't even know if Matt knows this. I've been in public office as a city councilman and trustee for total service was about 16 years. I've had the opportunity to work closely with EMS, fire chiefs, our police chiefs, our law enforcement officers, our firefighters, and things like that. And, I just have the utmost respect for these gentlemen because, they see things on a day-to-day basis that people shouldn't see. And I just have I hold them in high esteem because of what they have to go through on a day-to-day basis. And especially the last year or so with this COVID thing going on. But so hats off to those guys. I enjoyed that. Really, really, really good folks. Tarry Alberini, CEO of U.S. Safety Gear. We're a safety gear supplier in Northeast Ohio, hopefully the biggest, I think. We service some key accounts in the Solon area, which I'm thankful for. Matt's one of them. And talk about PPE just for a few seconds. And that train's blowing the horn, Matt. They're calling your name, buddy. The biggest thing that comes up right now with this COVID variant that's happening, how is PPE? Is it stable? How about prices? What about the supply chain? And what I can tell you is what I don't know is what I don't know. Things right now in the marketplace seem to have stabilized a bit, but the COVID variant has taken its toll on some of the glove manufacturers and some of the PPE manufacturers in Malaysia, Myanmar, Bangladesh, Pakistan, things like that. I'm proud to say that our company, U.S. Safety Gear, we were able to keep all of our customers in PPE through the whole COVID thing. Things were tight, don't get me wrong, but we basically took care of our secure customer base. And we had a lot of people call us up and say, hey, can you help us out? Can you do this? Can you do that? And we were able to help most folks out. But one of the things I did as a CEO of a company, I wasn't going to take away from the people who were loyal to us through this whole process and exchange that book of business for new business coming on. We don't do things like that. So anyway, the market's still kind of unstable. There's going to be probably a couple of glove manufacturers opening up in the U.S. to kind of circumvent the issue of product coming from Asia, which is good news for the country, hopefully. And the biggest thing will be, people will talk about price and things like that. So PPE right now, at the bottom line is it's kind of stable for the most part as of today. And I say as of today because who knows what's going to happen tomorrow? None of us know. This is a moving target, and no one really has the answers. But our goal at U.S. Safety Gear is to keep all of our customers supplied with PPE to the best of our ability. And I'm proud to say, we've done a really, really, really good job at that. The next slide, if you could slide it over, Caitlin, thank you. U.S. Safety Gear, we're diversified. We're also an apparel supplier too, as many of you know. And you'll see my email at the bottom there, talberini@ussafetygear.com. So Matt, I'm like in a really giving mood today, So if anybody wants to send me their logo, a JPEG of your logo to talberini@ussafetygear.com, I would be glad, and your shirt size, I will be glad to have our apparel group make you up a shirt with your company logo on there and send it to you at no charge. How about that? You can't beat that with a stick. But one of the things that we've done with the apparel, Matt and group, is that a lot of the HR professionals and the safety professionals have been able to tie safety themes into doing designs on T-shirts and giving to their employees and rewarding them for being safe. One of my favorite T-shirts is a shirt that says "I got caught" on the front, and on the back it says "Being safe at Nestle's." That design has really taken off, and we would be happy to do that for any one of your the folks in the Solon Safety Council. It's just such a great thing. But as you know, also U.S. Safety Gear is also the official apparel supplier to the Cleveland Indians. Even though the Twins beat them last 2 nights. I didn't like to hear that, but yeah. Here we go. So anyway, email me your logos at talberini@ussafetygear.com, and I would be glad to have our graphics people, which we have 3 on staff, take care of that for you and do some samples for you. And other than that, Matt, I think I'm good to go.
No, thank you for the update, Terry. Again, be considering if you want to join Terry's room for a few minutes in a little bit to kind of ask some questions there. It'll be great. But now we're going to turn it over to Bill Frankel from Be Well Solutions, kind of share what he and his company are all about. So Bill, why don't you take it away?
Wow, thank you. I'm looking at the picture that you have of me and I'm like, that's not me anymore. I'm way older. You're going to need an update. Thank you guys. Thank you for all the public officials who spoke, and thank you for what you do for our communities. Little bit about our organization and what we're doing, and then what we've had to deal with and how we've tried to help our clients. So we're a corporate wellness organization, and our mission has never changed since before COVID and after, although the way we've had to go about it has certainly changed. Our single mission is to keep people healthy. It's a win for them, it's a win for their families, and then it's certainly a win for the organizations, especially those who pay for or co-pay or pay a portion of their health insurance. We're trying to reduce the risk of heart disease, cancer, stroke, type 2 diabetes, and our huge uptick lately has been the increase in people wanting information on emotional well-being and mental health. And the shift we've done in our programming, not only to incorporate all the things that we and people can do to take control of their physical health, how they can truly prevent a heart attack, how they can truly prevent getting diabetes, how they can prevent having that stroke, but now how to deal with the stress, deal with anxiety, and deal with emotional well-being. Our platform is simple. There's there's three legs to our stool. We screen people. So we come on site to an organization with our nurses and our registered dietitians and our medical professionals. We take a little bit of blood, and within 8 to 10 minutes, we give them their cholesterol level. We tell them what their bad cholesterol is, their good cholesterol is, their sugar level, their glucose, their blood pressure, their BMI. And then we have a conversation with them about what their risk is of a disease and talk about things that they can do to reduce that risk. Simple things that they can do as long as they do them long term, like less soda, more whole grains, more exercise, things that we know, but sometimes things that we don't know too. We also encourage people going to their doctor. And during COVID, a lot of people, including me, my doctor was taking less and less people. I couldn't get into an appointment. So finding a way for people to utilize the healthcare system that were either afraid to go to their doctor or their doctor wasn't taking appointments. How do we come on site and do biometric screenings? And we had to be, and still have to be, very creative. Of course, all of our people are in PPE. We were doing outside clinics for biometric screenings. We were getting tents and trying to find any way that we could to let people know what their numbers are and understand once and for all, in simple, easy terms, what their risk is and things that they can do to reduce it. And then we put in a lot of interventional strategies, and this is where the emotional wellness is really just taken off. So we've always given talks, we've always had registered dietitians, we've always had health coaches working with people on things they could do to lose weight, eat a little better, exercise a little more, quit smoking, the things we can do to reduce that risk of chronic disease. But what we've been asked for more and more, which is my background as a licensed counselor, and I have, my own private practice for mental health, is stress management, anxiety management. Okay, things are emerging now and I'm supposed to come back to work, but I'm feeling uncomfortable about that. And what's this new normal going to look like? We've been giving talks on coping with change and how to keep going back and forth on dealing with the change, and whether you're working from home or whether you're coming in or whether you have kids at home or whether your kids are there, and all the stress and anxiety and change that people have been dealing with. And the third leg of our stool after the intervention is incentives. So almost all of our clients, our corporate clients, provide some form of a reward for people to go to the doctor, for people to talk to a health coach, for people to get a flu shot, for people to talk to the registered dietitian, participate in something that can teach them long-term habits. It usually comes in the form of a reduction in contribution towards health insurance, but it can come in the form of a lowering a deductible. It could come in the form of a dry fit t-shirt, but something we can do to encourage people to take control of their health and to live longer, live healthier, and not have those catastrophic claims that are going to keep increasing health insurance costs year after year after year. The other thing that we've been dealing with, and this happened this morning, and I know some of you have been dealing with supply chain issues. We've been dealing with our own. So one of the other things we do this time of year is we come on site and provide flu shots to organizations. And we've been doing COVID testing for people, and again, the biometric screenings, but there's a supply chain issue with flu shots, but we've been kind of scraping by day after day, and we're talking tens of thousands of flu shots for our clients in Northeast Ohio and the country over the last couple months. And luckily today we got another big shipment in, so we're way happy. Over the last couple of years, we've been able to develop relationships with some of the insurance carriers, especially in Northeast Ohio, that's included Medical Mutual, where we can submit biometric screening claims and submit flu shot claims straight to Medical Mutual, straight to Anthem, with no out-of-pocket cost to the organization. But again, our goal is twofold: keep employees healthy, have them reduce their risk of disease, live long, happy lives and their families. And then two, help control health insurance costs by people utilizing the healthcare system well and not having those catastrophic claims, and providing that holistic approach, physical health, emotional well-being, financial well-being for our participants and their organizations. Thanks.
Cool. Thank you, Bill. Especially with all the mental health challenges, I know your company plays a key role in that. So again, team, be looking forward to maybe ask Bill some questions in the room that he'll be in here in a minute. We've got, last but not least, we've got Tony from Ving. Tony, why don't you take it away?
Okay, just had to get the unmute there. Well, thank you so much for having me in to the virtual meeting today. Definitely taking advantage of the opportunity to talk to so many people at one time and share our experiences across the country and what's changing as a result of the COVID impact. But first, a little bit about who we are and how we fit into helping companies like the folks that are on the phone today in adjusting to the way things are today. And we've actually just stopped saying the new normal. We've started talking to our customers around employee expectations, because things have changed for employees coast to coast. And our platform is really helping employers keep their employees engaged with critical information on the job. So a lot of people know us around the country as a full-featured training management system and communications platform. So one of the things that's changed in COVID is many of our customers have expanded way beyond training management and into general communications around safety, quality on the job. And because we've built our platform for people in the workforce, such as the leadership, the admin, safety, foreman, the use cases starting to expand as their worlds become less in person, face to face with everybody, and more on demand or virtual communication outside of an organized webinar like the one that we have today, where they just have to get information out there. Go ahead and keep advancing. So they're tapping into more and more of our courses. So where a lot of our customers used to really just tap in to our safety training, OSHA required, OSHA recommended, and skill sets development, we're now seeing a lot of customers, especially since COVID hit and as things evolved, tap into things more like microaggressions in the workplace, things like harassment programs, things like more and more on ergonomics than we've seen across the board, because people are changing their work environments. And then certainly we have found the heightened need for staying connected to the organization. So where our customers have typically looked at dashboards, tracking and reporting as a sense of compliance, and are my people compliant with the required materials they need to complete for training? Now people are looking at their dashboards and they're thinking about, am I reaching everybody into the sense where I know they got it, read it, watched it, and that they're helping us to prevent spread of COVID on the job or impact after people have left the job, and how do they keep pace? One of the things that we do is the client list across the bottom is just there. Basically, that's a sample. We specialize in working with people who make stuff. So construction, manufacturing, all of the trades from HVAC to roofing to concrete. So when we talk about working in their environment with our technology and our content and adapting to their world, these are the folks that they're the mud on the boots, the glasses, the hard hats. They're in a very diverse work environment out there. Not only do they have to do all their OSHA stuff, but now we have all this COVID stuff. And since the pandemic hit, communications started to change quite rapidly around working conditions and or expectations of the customer when you show up at the site. So people are using the platform a lot more. Go ahead to the next slide. It became about overcoming challenges in the workplace for so many of our customers. They already had this sense of challenge. Yeah, go ahead and click through those. They already had this sense of challenge and how do we keep people safe on the job? But when furloughs started to happen, uncertainty around shutdowns, uncertainty about coming back to work, uncertainty about my new work schedule of working in the office and working at home, what's expected of me. All of these things required heightened communications. Not to mention, we were changing the dynamic and limiting the number of people who could gather in a group, creating remote work environments in companies that had never thought of adopting a remote work environment. How do I manage? How do I monitor? How do I ensure that these people that are no longer connected to our organization in the office feel that same sense of connectedness? So what we find is people are using a technology like Ving to create micro communications across these 6 areas. These are the big trending areas across the country, where so they can make sure that their employee base on shift 1 or shift 3 or in plant 10 or plant 1 is all on the same page. Go ahead. So what a lot of people are doing is rising to the occasion. They're taking their standard method of employee engagement from that in-person meeting, or just blast an email out, or send them to YouTube to watch a video, and feeling like they need more control of the level of engagement and how can they drive to higher levels of engagement with critical on-the-job information. And in organizations prior to COVID that were really standoffish around doing virtual meetings and or on-demand learning, they had to change the way they think. Well, many of them found that it was way more effective to create a balance between on-demand and in person. They saw great gains in efficiencies. They saw great gains of people on the job versus pulling them off the job for training. So now people are thinking their new normal, the way it's going forward is they're looking at a training or they're looking at a situation where something has changed and saying, what's the appropriate method for communication? And then leveraging tools. So they're creating a variety of on-demand, short, relevant, frequent communications and mixing it up. And our team at Ving is very good at doing all of this kind of thing. So we provide best practices all the time to our customers on how they can not only take our content and customize it to their environment, but they can create their own micro engagements with their customer base. So we're really seeing this trend stick, where once people were standoffish about on-demand or too much communication through digital means, we're finding that evolution of COVID forced them to think differently. And as a result, they're finding benefits in efficiency and increased engagement and sense of connectedness by their employee base. And so the benefits are just really wall to wall, A to Z across the board for our groups. And I think that's the last slide that I have there.
Oh, that's great. Thank you so much, Tony, and just to appreciate all the 6 partners sharing. What we're going to do now is just going to give you a couple guidance here. We're going to break out into 1 of 4 breakout sessions for further discussions. You've been pre-assigned a group. That doesn't mean you have to necessarily stay there, but it'd just be easier than everybody trying to pick one. So you'll be put in here in about a minute, be put into one of those breakout sessions. You'll have the ability to switch rooms at any time. If you're having trouble switching rooms, please send a chat to Thomas Bennett or Kaylin Mills, and they can manually switch you to another room. We are not going to be bringing everyone back for wrap up. So we are, just again, move from room to room. And once you've gathered some information, certainly feel free to head out, but take advantage of the opportunities. You can ask specific questions and get specific resources. We will have steering committee members in each of the room to help take notes and send out a recap and help facilitate the conversation. So I think without further ado, Kaylin and Tom, why don't you send us to our rooms and